Hello everybody and welcome back to another episode of the Mental Sphere with me, Dr. Nyamote. So for the past few weeks we have been discussing about addiction, and our last video we talked about alcohol addiction, and if you missed any one of these videos, be sure to check out the description box below for the links to these videos. This week we are going to cover heroin and opioid addiction, so stay tuned and let's get this started. What exactly are opioids, you'll ask, yeah? So opioids are basically substances that are either naturally or synthetically derived from a plant called opium. And what opium does in our bodies is basically to mimic a very important chemical in our brain called endorphin. And endorphin works to help relieve pain whenever we have been injured from whatever situation, and it also helps with giving us that sort of euphoric state, sort of happy feeling when you do something. Yeah, so opium tends to mimic this very important chemical. So we use opioids in medical care, especially in mild to moderate to very severe pain syndrome. So if someone has just come from surgery, or in very chronic illnesses such as cancers where someone is in very severe pain, we may use chemicals derived from opium to help us relieve this pain in people. Yeah. So when it comes to opioid abuse, for the purpose of this discussion, I'm going to divide it into two different types, and that is the one from street drugs such as heroin, and that from prescription medication, that is drugs that are officially licensed to help deal with pain medication but are commonly abused. So these drugs can include morphine, that we commonly know of, codeine, that is found in a lot of painkillers, and cough syrups. We also have pethidine and fentanyl and hydrocodone and very many other drugs that are prescribed by your doctor whenever probably you're in a lot of pain. So in addition to the signs and symptoms that we talked about in regards to addiction, there can also be symptoms of euphoria and feeling very mellow and the least worried and bothered about a lot of problems or a lot of issues going on around their lives. They can also be increased drowsiness and increased confusion. And one very important symptom that bothers a lot of people with opioid addiction is constipation. Yeah, it can be a real bother. So another very important thing when it comes to opioid addiction is when it comes to overdose. And this can be potentially life-threatening. So things that can help point out that someone could be having an overdose is you may notice changes in their breathing patterns, and they may be vomiting as well. And the other thing is there'll be increased confusion and increased drowsiness. They'll probably be mentioning or talking in a manner that you cannot really understand what they're saying because they are not quite oriented in time. And the other thing is, with this increased confusion, increased drowsiness, they may actually lose consciousness. And as I said, this can be potentially life-threatening. So when it comes to withdrawal, the thing about withdrawal symptoms is you will find the signs and symptoms, or rather the effects of the drug that we had alluded to earlier. The withdrawal symptoms will be on the other end of the spectrum. So we talked about constipation and extreme drowsiness, and when it comes to withdrawal, you'll find that the person will be having diarrhea and vomiting and having insomnia and not being able to sleep for 3, 4, 5, 6, 7 days. You'll also find that they'll be very restless. They may be having body aches and muscle pain and just being very dysphoric, being very sad and low all the time. And Nonetheless, this can be very uncomfortable for the individual, and they do need some medical attention, may need some medication to help them get out of this phase. So now this brings us to treatment of opioid addiction. Most of the time, individuals will come for treatment when either they've had an overdose or they are experiencing withdrawal symptoms. So what we'll do in the initial phase is basically treat whatever is urgent, whatever is now. So if it's an overdose and someone's having breathing difficulties or they're unconscious, of course we want to reverse that first before anything else. If they're having withdrawal symptoms such as feeling very restless and having insomnia, diarrhea, we want to treat that first before we move to anything else. So we want to take care of the physical needs first before we move to the mental health care needs. So another thing that will happen during the initial phase, after one is stable enough, is you'll have a mental health assessment to just see if you're having any other difficulties that will need to be addressed as part of your care. Then we'll move to the intermediate phase, and in this phase there will be the opioid replacement therapy. In our community, what we commonly use is methadone. So this is basically an opioid that is much safer and administered in a much safer manner. The has been well studied, so it is much easier to monitor compared to other opioid medications out there. And compared to things like injection, this one is given orally, because if you're injecting heroin, for example, there's the risk of getting HIV, hepatitis B, things such as just skin infections around the injection site, to even infections on your blood vessels that are being injected. So the methadone is supposed to be much safer. Then, of course, there comes the therapy and the addiction counseling that has to be done to help you recover in your recovery journey, basically. And of course, we'll have the group therapy and the community support groups. And another important thing to remember is during your replacement therapy and just your whole recovery journey, you may be subjected to urine tests to just see, monitor how you are progressing with the treatment that you're being given, and so that if you're having any other drug in your system which may potentially cause other problems, it's something that can be addressed in time before it complicates to become anything severe. And the important thing to just always remember is sometimes you may get a relapse, and don't feel embarrassed to tell your practitioner or whoever's in charge of your care plan. And this is because it can happen, and it's okay. Don't feel that you'll be judged, because they're there to help you, they're there to assist you in whatever way possible. And just be open about it, and nonetheless don't ever feel that you need to hide your addiction problem, because it's an illness. As you've said, it's an illness just like any other illness, and I hope that you can receive the care that you require and that you need in one way or another. And that brings us to the end of our video. Thank you for tuning in into this week's video. Happy Father's Day, and I hope you have a lovely weekend. Did I say Happy Father's Day? Yes, Happy Father's Day. And see you next week as we talk about stimulant addiction. This one's a very interesting one, because you coffee lovers are in for something. And so see you next time, and take care.